Um, it has always been difficult to know at what level is your practitioner and trying to find the right person for you. I love the statement, well, you know, I go to Dr. Smith because he's at our golf club and he's really a good golfer. Well, that's fine, and he may be an excellent dentist too, but he may be just a good golfer. Uh, so you've got to kind of blend this. Luckily, most of dentistry doesn't need a high level of work. There is a kind of a master's level that you are involved with the more elaborate patients and conditions. Um, I think being able to talk to people that have had work done, sit down and talk to them about it if they're willing to. Um, if necessary, ask the practitioner for photos of what he's done. There's nothing wrong with that, to just see and ask him, is it your work or is it someone else's work? I just had somebody who came in for a second opinion, and that's another thing, is to get different opinions. The problem is it gets difficult. It's hard for the patient to be able to separate out this sometimes. But the lady I saw today came in, and she said that they wanted to do a different procedure in orthodontically moving her lower teeth. They were going to go in and cut the bone between all the teeth. They're going to put some bone in, and they're going to move them all rapidly. And she said, well, one, I'm not in a big hurry. I don't mind if it's going to take a while. And she said, well, how many of these have you done? And the surgeon said, well, I've done 4 of them. Well, that was an excellent question, because she decided she didn't want to be the 5th or the 7th. She'd like to be the 100th or 200th or 500th. She didn't want to be the first 3 or 4. So asking the right questions many times and not being afraid to ask the question, have you done this before? In fact, I just had some knee surgery by a very good friend of mine that does a lot of sports type of injuries. And I kiddingly said to him, I said, hey, Tom, how many have you done, as I was on the gurney going in? He looked at me and said, I stopped counting at 5,000. And, you know, but when a patient is really wanting to investigate, you know, is this, I think to have a good talk with the dentist, see the work that he does, ask if he has some patients that are willing to, you know, to sit down and talk to them, or do some investigating yourself. There are many times patients will come in and say, you know, I've checked you out by boom, 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 you know, all different ways. I don't know some of the ways that they're checking you out, but I appreciate that. I appreciate it when a patient comes in and said, you know, I've really Googled all these things, and, you know, I'm a little confused about this and that. That's all right. I think it's great. The more they understand, the better it is for us. In dentistry, most of the time you get what you pay for, and where you think you're cutting a corner, you're probably cutting it in ways that you wouldn't like if you knew, you know, what's going on. Part of the problem with the patient's understanding is the quality of the labs that are being used. We're running into a lot of laboratory work that's being done overseas. We're finding that certain types of metals that are being used, which we've banned over the years, and they're sneaking back in. We see it as periodontists because the tissues are reacting to them. For instance, nickel is one of the metals that we've tried to stay away from here in the United States. So you've got to be very careful when you start shopping for price. If you have a practice where you're trying to do high volume and cut the costs so you can bring more people in, something is usually giving way somewhere. And it's usually in the quality of the work or the quality of the lab that's being used. A lot of patients don't realize that there's a wide variation in what laboratories will charge. So it's at the dentist's discretion where they're going to send the impressions and what type of quality work is coming in. And very few patients know that or know how much of a variation there is. Some practices will actually outline it for the patient. If you want the very best, we'll send it to Switzerland. If you want some of the others, it's going to be maybe 2 times what the normal costs would be. So the patient gets a feeling for, the differences of what can be done. Some patients don't care, they just want it close. Other patients, they'll take a magnifying glass and check, the work that's been done. There's nothing worse than doing anterior dentistry and having a patient go home and have a loved one or a child or go, gee, that's terrible, that looks horrible. And then to try to get a dentist to take it off and redo it is many times difficult too. So you've got to be careful, and we have never had the degree of this advertising type of thing, at least in the Midwest, as we're getting now. So it's important that you check it out and you're sure, what you're getting for your price.